Let's now take you to Ghana, where at least 28 people have died following an outbreak of meningitis. The bacterial infection has affected more than 100 people since October last year. Public health officials confirmed they are sending emergency supplies and support to the affected regions. Here's Katerina Vittozzi with more.
Ghana's Ministry of Health has confirmed that at least 28 people have died in this latest meningitis outbreak. The infection has now affected 3 regions in the northern and central parts of the country, and since October last year there have been reported 100 cases. Now this is the pneumococcal strain of meningitis. It's a bacterial infection which is spread via human-to-human bodily contact, although it's not as common or contagious as the common cold, for example, and it is more likely to affect the vulnerable, such as young children, the elderly and people who are already unwell. Now Ghana, northern Ghana in particular, is part of what public health organisations call the African meningitis belt of sub-Saharan Africa, and outbreaks of the disease are more common during the dry season, which we are now in currently. Now, the Ghanaian government say that early treatment and early detection really is key, and they're calling on all people to be aware of the symptoms, and if they experience things such as a headache, a fever or a stiff neck, to report to their nearest medical facility. Health resources and medical supplies are being ramped up in the affected regions. Public health bodies want to avoid the outbreak that was in the country back in 1994, where there were 17,000 cases during one epidemic and more than 1,000 people died. Katerina Vittozzi, CCTV, Accra, Ghana.